Welcome to a new episode of our weekly series, COVID-19 Science in Context. This week, the UK took their next step on the roadmap out of lockdown, allowing people to meet outside and opening outdoor sports activities. The UK has reached over 4,345,000 confirmed cases, and over 31 million adults have now received the first dose of their vaccine. I'm Sabine, and joining me today is Dr Anne Cori. Anne, since schools opened earlier this month, more data on cases has become available. What does this tell us and what does it mean for this next step?
Well, since schools reopened, transmission has increased as expected, and the reproduction number is currently around 1. So we are seeing cases that are starting to rise again, but this is mitigated with intensive testing in schools. And we've not yet been able to measure the impact of the latest reopening phase, which started on Monday. But the UK has been doing really well in its vaccine rollout. Uptake has been really high so far, so this is good news. However, our modelling suggests that as we further reopen, there will be another epidemic wave. This is because some individuals are not eligible for vaccination, some are not taking up the vaccine, and the vaccines are not 100% effective. But in most of the scenarios that we've looked at, this next wave is much smaller than the last two, so I am cautiously optimistic.
Looking forward, what does this mean for the next few months?
Well, one of the key parameters that will influence the size of this next wave is vaccine effectiveness. And we don't really know at the moment for how long vaccines give protection. And we're starting to see evidence that the vaccines don't protect well against all variants. So we may need booster vaccines, and we need to make sure that every country gets appropriate access to vaccines to protect their populations. And this is critical for those countries to minimize the health and economic impact to the individuals living there. But it's also important for us because it will help us stay away from immune escape variants and keep the benefit of our successful vaccination campaign.
Thank you so much for your time.
Thank you.